While you are settling in, this is a good time to establish positive habits at home, like recognizing when it's best to feed. Dr. T. Barry Brazelton was a renowned American pediatrician and researcher who identified 6 different states of alertness in newborns. These help us understand when a baby is most alert and ready to feed. Take time to recognize the different states so you are better able to assist in getting your baby to the best state for breastfeeding. Mickey will help us understand what we need to know and observe.
So we're now going to talk about the states of alertness, okay? Dr. Brazelton identified 6 of them.
In deep sleep, a baby lies still and quiet. Their eyes are firmly closed. Breathing is deep and regular. Occasionally, your baby may startle, but they will stay asleep.
So here we have Lenny in a deep sleep. Her eyes are shut. She's breathing regularly, and her extremities have no movement.
Deep sleep is especially important for growth and memory integration. In active, light sleep, a baby will move while sleeping. Again, they may startle at noise.
The baby is asleep, but you may see their eyelids close, but their eyes are rapidly moving like back and forth.
Infants' arms and legs may be more active. Their body may twitch. They may make faces, frowns, smiles, mouth movements, and sucking. Breathing may be irregular or shallow. Overall, the infant is more easily aroused. Active light sleep is important for brain growth. In a drowsy state, a baby's eyes may open and close, but they'll seem unfocused or glazed. They may doze while their arms and legs move smoothly. Breathing is irregular but seems faster and shallower than in sleep.
So here Lenny is displaying drowsy. Her eyes are opening and shutting a little bit, and there's a little bit of movement still in her limbs. During this stage, babies can be soothed to sleep or woken up.
Drowsy babies may be stimulated to become more alert and responsive. So, Mickey and Mom find her baby in an active, alert state. It's a good time to feed.
Here we find Danny, quiet and alert. This would be a great time for parents to pick their child up and either engage them in a breastfeeding session or getting to know him so that he can get to know mom and dad.
An active, alert baby's face and body are still, while they have wide, bright, shining eyes. They react predictably to sights and sounds. Active, alert babies are willing to play and interact. Alert, fussy babies show jerky movements and startle themselves. They will react to sights and sounds. Their eyes may be open, but they are less engaged. They may be soothed with a little stimulation, but with too much may become fussy or even cry.
So now would be a good time as a mom to pick her up and see if she has to burp, if her diaper needs to be changed, if she needs to be cuddled, or if she's hungry.
A crying baby is pretty obvious. It's also normal. Crying is often the baby's main communication tool.
So here Lenny is exhibiting the stage of crying. Her face is scrunched up. She's changing colors a little bit. Her legs and arms are going back and forth. She's breathing a little bit more rapidly. Her eyes are squeezed shut.
Cries and screams can make you feel immediately anxious, angry, or guilty. but crying gets your attention. Different kinds of cries can tell you about hunger, pain, boredom, discomfort, and tiredness. For breastfeeding to be successful, your baby should be comfortable and alert. We call that a feeding cue. A couple tips. It's harder to calm a child down than to catch them when they are quiet and alert. When your baby is ready to feed, delay other things, like changing clothes or diapering. If your baby is crying, you've probably missed the best time for feeding. Later, we'll talk about ways to recover.